Brain metastases are a very complicated topic because they are tending to respond not as well as the rest of the body to any given targeted therapy. Therefore, it was a very important question whether brain metastases genetically are different from the main tumor and potentially also other organ sites in the body. In that study, 86 samples of primary tumors, distant metastases and brain metastases have been genetically analyzed in a very, very deep fashion. And the results show that every metastasis, of course, has some portion of genetic alterations of the main tumor, but these metastases are developing further. So only 50% or less of the genetic alterations are maintained from the original tumor, but there is a further development in the brain metastasis. Most interestingly, metastases in the brain compared to metastases at other organ sites are developing differently. So it's not the same genetic alterations these metastases harbor, it's different. In the brain itself, the brain metastases are pretty similar to each other or are very, very similar to each other. This trial has implications because at the end, if you want to sufficiently treat a patient with brain metastasis from a solid cancer, you need to obtain tissue from that brain metastasis and not just deduct from another organ site, but really do genetic analysis on that brain metastasis. There has been data from a lot of uncontrolled trials in the past and also from preclinical experiments which hypothesized that valproic acid, a drug pretty commonly used, especially in the past, for the treatment of seizures associated with brain tumors, that this drug would effectively enhance treatment response to either radiotherapy, radiochemotherapy, or chemotherapy. To substantiate whether there is a role for valproic acid as a co-treatment other than treating seizures, a trial was designed where 4 independent data sets were conjoined and an independent analysis of the effects of valproic acid on treatment outcome was done. And then a very simple question was posed, and this question was, is valproic acid enhancing efficacy of radiochemotherapy in one of the trials? The result is no. There's no indication that valproic acid is enhancing radiochemotherapy for glioblastoma patients in the newly diagnosed setting. More importantly, because we have more modern anticonvulsants now, and there's also now data around that another anticonvulsant may enhance treatment response, and the same analysis has been done for levetiracetam, a more modern anticonvulsant drug, and again, there's no indication that levetiracetam is enhancing outcome of newly diagnosed glioblastoma patients. Plus, in our perspective, the books are closed on using these drugs to enhance chemotherapy, and in our view, a phase 3 trial on that drugs is not warranted.